Federal Drive is presented by GEHA, Government Employees Health Association, proudly providing health and dental benefits to federal employees and their families. Visit GEHA.com.
The Department of Health and Human Services carried out widespread layoffs a year ago. Now it's sending out a second wave of reduction in force notices. HHS says these are more targeted layoffs, targeting employees it missed when their offices and programs were eliminated last year. All of this is happening as HHS embarks on a hiring surge. Federal News Network's Jory Heckman has been keeping up with everything going on at the agency. Jory, welcome.
Hey, Eric.
So let's start off with the layoffs last year. You widely reported on them. How big were the last year's layoffs at HHS, just for scale?
That's right. So HHS carried out a reduction in force of about 10,000 employees last year. And it also, through voluntary separation incentives, the deferred resignation offer, the early retirement offers, it got another 10,000 employees to voluntarily leave the organization in the lead up to those RIFs. So altogether, a reduction of about 20,000 employees last April of 2025, and they reduced their workforce from about 82,000 employees to about 62,000 employees.
Where did that stand as far as ranking? We saw a lot of RIF notices and fork in the road, people taking the buyouts. Where did that stand as far as other agency RIF notices going out?
I think it ranks up there as one of the more substantial reductions in force in a year that was pretty full of these kinds of situations happening at all kinds of different agencies. HHS, of course, is a large federated agency. It has a lot of different components, but even when you look at it that way, this is still a real significant reduction in manpower for HHS, and we have seen the consequences of that. There have been, some entire programs and offices closed as a result of those RIFs. Just basically HHS saying that there are some offices that were around that were no longer aligned with the Trump administration's priorities.
Yeah, and in that vein, it seems as if the agency is not finished. What are these RIF notices that are going out now to some of those programs that were eliminated and just some folks were left off the table because of oversight? What happened there?
Yeah, so it's really more of the latter situation. HHS recently notified about 78 employees, so a couple dozen employees here, saying that they are also getting reduction in force notices. This is a follow-on to the RIFs that we've just been talking about that occurred last year. Essentially, these are employees who worked in programs and offices that were completely eliminated through last year's RIFs, but through some quirk of the data, they were not let go when these offices and programs were terminated. And so they were reassigned to other places. They kind of flew under the radar for a bit. But HHS at this late date has realized that they were working in programs that they've closed. And they are also telling these employees that they no longer have a job at the department.
And HHS at the same time is embarking now on a hiring surge. Are they just trying to backfill some of the folks that may have left from taking the buyouts, or is there other initiatives that they are trying to advance in these hirings?
Yeah, so what we've learned from HHS top officials in all of this is that they were not so much concerned about the headcount number, the quantity of employees at HHS, but they were looking at employees who were politically aligned with the Trump administration, who are willing to support the administration's priorities. This is all coming from HHS Secretary Robert F. Kennedy Jr. He told appropriators on the Hill recently just as much. He said that HHS is looking for a better group of people. He says that people who were at the agency in the early days of the Trump administration were not on board with his Make America Healthy Again agenda. And so that this was a clearinghouse situation where the people they now have on board are more aligned with that vision. I mentioned earlier that after these RIFs and all these workforce reductions, HHS had a headcount of about 62,000 employees. Currently, they're closer to 72,000 employees, and they're looking to hire about another 1,200 employees as well. So they're actually going to slightly increase their headcount compared to where they were before these RIFs.
Speaking here with Federal News Network reporter Jory Heckman. All right, so that gives us a little bit of insight of where things are heading. What else is going on as it pertains to HHS's workforce as of today?
Well, we've caught a glimpse of what's going to happen next with the rebrand of Schedule F. which is better known these days as schedule policy/career. That's going to be moving out for the department and soon the rest of the federal government here. What we've seen in a memo is that HHS is telling employees that hundreds of GS-15 positions will be reclassified as schedule policy career fairly soon. To catch you up on all of this, schedule policy career is a new classification for federal employees, largely in policymaking positions. They would be moved to basically at-will designations. They would be easier to fire under this new designation, and they'd have fewer appeals rights as well. So that's something that's really gotten a lot of attention, and we're seeing that that's soon to come for HHS.
What comes next? What will we be talking to you about next time we have you on to discuss HHS workforce initiatives?
Well, we'll soon see the next steps in terms of implementation of schedule policy career. This is something that all agencies are working on right now. They've been gathering lists of who would be converted to this new designation, and none of this goes into effect without President Donald Trump issuing an executive order saying that these lists that he's received, these are the positions that will be converted, and that will be the reality going forward. So we're going to be keeping an eye out for when that executive order does cross his desk.
All right, you can be sure we're going to hold you to that. Federal News Network reporter Jory Heckman, thank you as always.
Thanks, Eric.